Welcome to Decoding Healthcare Research, a podcast by Agora Project. Join us as we delve into the behind-the-scenes world of groundbreaking research and the dynamic healthcare industry, interviewing top paper authors, engaging experts on industry-related topics, and exploring medical subjects that affect our daily lives. And now, your host, Dr. E.F. Rain.
Welcome to our podcast, Decoding Healthcare Research. I'm your host, Efrain Riveros, Dr. E.F. Rain. Today, we are going to be discussing a very important topic of obesity and exercise. And we have a very special guest. We have Dr. Vassilis Mougios. He is a professor at Aristotle University in Greece. He has devoted his professorship to high-quality education and research in exercise, metabolism, nutrition, and healthy living. He works at the Laboratory of Evaluation of Human Biological Performance at the School of Physical Education and Sports Science in the Aristotle University in Thessaloniki, Greece. Welcome, Dr. Mougios.
Thank you very much, Efrain, Dr. Riveros. It's a pleasure to be here.
Thank you so much. So we are going to give an outline of what the interview is going to be like. So we are going to start by discussing the metabolic pathways associated with obesity. And after that, we will discuss a little bit about the benefits of exercise, the type, duration of exercise that can be recommended, and more specific topics like weight regain, fatty liver, and all these cascade of events that are associated with all the comorbidities related to obesity. So first of all, I want to ask you, Dr. Mougios, for how long have you been working in this important topic?
Well, I've been working as a faculty member at the Aristotle University of Thessaloniki since 1989. So I have completed about 34 years of research in various topics, including how exercise can fight obesity.
That's great, and it's interesting when I was reading the papers that you have had a long line of research in this aspect, and the obesity part is probably one of the most interesting topics because in our audience has been a theme, not only for the public in general, but for physicians in the way they recommend different strategies to lose weight. So I would like to start with a little discussion about the metabolic pathways that lead to obesity. How a person with a normal weight transition into that morbid state of obesity, probably starting with just a little bit of overweight and then ending up with the full-blown obesity. So the transition is associated with some metabolic changes. What is going on in our body when we transition to obesity?
Okay. Let me start by saying that obesity is recognized nowadays as a multifactorial disease, a disease that has several reasons. The main reason, in my view, and of course in the view of most researchers, is a chronic, a prolonged imbalance between what we call energy intake and what we call energy expenditure. So we can imagine our body as having scales, like the old-fashioned scales that you can see, for example, justice holding. So if we place energy intake on one scale, the more energy we take in, the more calories, the more we eat, goes in this direction. The more energy we spend in our everyday activities, including exercise, goes in this direction. So ideally, we would like the two scales to be at the same level, and then we have what we call energy balance. When we have energy balance, we neither gain nor lose weight. But if there is an imbalance, and we're not talking about great imbalances, a small imbalance of, say, 50 or 100 calories per day can end up in a great difference in the long run. So if every day I have a small imbalance, the scales tip in one of two directions. If my imbalance is in favor of energy expenditure, then I will start to lose weight. But if the imbalance is in the direction of energy intake, the balance will tip in the direction of weight gain. And this is the fundamental reason why we gain weight, because every day we get a little more energy than what we need. The body has tremendous and very effective conservatory mechanisms that have been galvanized over millennia of evolution. So if I take in more food, the body has no way of saying, I don't need that, I will throw it away. The body says, oh, that's a good opportunity to store it because I don't know if tomorrow I will have enough food. Today we have plenty of food, but hundreds or thousands of years before, our ancestors did not know if they will have food today or tomorrow or next week. So through evolution, for survival reasons, we have developed mechanisms that today get back at us. We have developed mechanisms of conservation that today take the revenge and say, you can't change this mechanism. If you give me more, I will save it. And the main place we save the surplus energy is our adipose tissue, is fat. So primarily, if we overeat or under-exercise, we deposit a few grams of fat in our adipose tissue during the day. And this is done through a metabolic pathway that we call lipogenesis. In other words, we use the excess fat in the form of fatty acids, but also the excess carbohydrate in the form of glucose to synthesize what we call triglycerides or triacylglycerols. And these are the main molecules of storage of fat in our body. So we do that all day long. After a meal, we use the contents of the meal to store some triglycerides. But during the hours that we do not eat, the hours of fasting, or if we exercise, then we mobilize the reverse process, which we call lipolysis. And through lipolysis, we break down our triglycerides into what we call glycerol and fatty acids. And then these components exit. They go out of our adipose tissue, travel by blood to the body, and are used up for energy by other tissues. Our liver uses fat, our muscles use fat. So we have two fundamental biochemical pathways as far as fat is concerned. Lipogenesis, which is favored when we have a surplus of fat or food in general, and lipolysis, which is stimulated when we have a deficit of energy. Again, this establishes a cycle. We call it the triglyceride fatty acid cycle. So if we have triglycerides here, they are broken down into fatty acids, and then fatty acids are reunited to form triacylglycerols. This cycle has a turnover of about 1 to 300 grams per day. And in an ideal situation, the two halves of the cycle will be equal. Every day we synthesize as much fat as we break down, or reversely, we break down as much fat as we synthesize. When we introduce an imbalance in favor of energy intake, then we synthesize more fat. So lipogenesis takes over lipolysis, and so at the end of the day, some triglycerides are left in our adipose tissue. It can be just 10 grams per day, but if you add it day after day, you will get half a kilo or a kilo of fat in a matter of, say, a few weeks.
I see. And I find interesting that this cycle may change between people. So my question to you is it different from is it different if you compare males and females in terms of the speed of that cycle on a daily basis?
It isn't. It has approximately the same turnover in healthy males and females. Of course, females have more fat deposited. Okay, as they enter adulthood, females deposit more fat. But an adult man and an adult woman will have the two cycles operating at approximately the same speed.
So you mentioned that there is a balance, right, between energy consumption and energy expenditure. So on the side of expenditure, then exercise enters the equation. Yeah. So doing exercise, there are different ways of doing exercise and different types of exercise. Resistance training, endurance training. So what are the differences between them, and what is their contribution to this energy expenditure under different circumstances?
Okay. One very popular type of exercise is what we call aerobic or endurance exercise. This is characterized by a rather moderate intensity for a long time. For example, if I do jogging, this is moderate intensity exercise. This kind of exercise has the advantage of great energy expenditure, because I can spend a considerable amount of energy per minute for many minutes. It is easier for me to jog for, say, half an hour or 1 hour than do sprints. A sprint will have a higher energy expenditure per minute, but we usually cannot run at very high speeds for many minutes. So overall, the scientific community agrees that the most effective way the most effective type of exercise to fight obesity is moderate intensity exercise, because it has a good combination of per minute energy expenditure and duration. So this is the first thing, and of course it is also applicable if we have an obese or overweight person who usually is not very fit. It is easier to ask them to do a walk or a brisk walk or even a light jog than to ask them to do a sprint or to do what we call high intensity interval exercise.
So will it be the same if the additive amount of exercise throughout the day would have the same effect as putting it together in 30-40 minutes?
Yes, because as I said, what matters on the scale is the amount of energy that we spend. So people should choose forms of exercise that will maximize their energy expenditure. If there are people who can do that with high-intensity interval exercise, that's fine, because high-intensity interval exercise has the advantage of time efficiency. In other words, if you can do it, because it is very demanding, you can devote less time to it and have the same energy expenditure. If I can do high-intensity interval exercise, I may spend in 10 minutes the same amount of calories that I spent doing 30 minutes of jogging. So if people don't have much time available, high-intensity interval exercise is preferable. And
that's pretty interesting.
Yeah. So, today many people, run from one thing to another, from one job to another, and they say, I don't have too much time available. So we tell them, if you can do high-intensity exercise without getting injured or fainting or getting exhausted, do it.
Yeah.
Do it. But I've tried it myself, and it's very demanding. You have to be very, very focused and, of course, fit to exercise at high intensity for a short while. So it's like having a palette. Exercise offers many opportunities. One may choose a moderate intensity jog if they have the time available. One may choose high intensity interval exercise, and also one may choose resistance exercise, which also has the disadvantage of a low energy expenditure. Because if you do, for example, a resistance exercise session in the gym for 50 minutes, most of the time you rest. You do a set lasting, say, 45 seconds, and then you rest for a minute, and then you start again. So overall, resistance exercise is not very energy. It doesn't cause a high amount of energy expenditure within a certain time. But the other advantage of resistance exercise is that you gain muscle mass and strength. And by doing this, you get two advantages. First, you are more capable of carrying out everyday activities, like climbing stairs. And also, you become more able to perform moderate intensity exercise. If, for example, I strengthen my leg muscles, then I can do the jogging more easily, or I can run faster. So one advantage of resistance exercise is that it strengthens you generally and may allow you to exercise harder. The other advantage is that if you increase your muscle mass, you increase your basic metabolism, which is one of the components of energy expenditure. In other words, every day we spend a lot of energy by just sitting. If a person just sits for 20 or lies for 24 hours, they will still spend a lot of energy. And this is what we call basic metabolic rate, formally, or basic metabolism in lay terms. This basic metabolism depends on the amount, depends primarily on your body weight. For example, if somebody weighs more, they will spend more energy just sitting, but it also depends on muscle mass. If I compare two persons that have the same weight, the person that has a higher muscle mass will spend more energy just sitting, because muscle tissue is metabolically more active than the other tissues. Just to maintain my muscle functioning, just to maintain what we call muscle tone, which is its minimal contractile activity, I need energy. Adipose tissue fat doesn't need that. So if I have a higher proportion of muscle tissue, I will spend more energy at baseline, and this may also contribute to weight loss, because there will be more energy on the scale of energy expenditure. So I can say that all forms of energy are good, and they are good not only for general health or cardiovascular health or fitness, but also in the management of obesity. But between these forms of exercise, there are slight differences that health professionals should know and adjust their recommendations accordingly.
And I found a concept very interesting in your paper that has to do with the synergistic action of both types of exercise, because the metabolic pathways, you need some time to recruit the whole metabolic cycle. So if you spend a short period of time just doing, say, resistance training, you start all the cycle of energy expenditure. But if you supplement it with the endurance training, then you recruit the whole pathway. Can you elaborate a little bit more on that?
This is correct, yes. I can say that we can divide our metabolism during exercise into three energy systems. The first we call the ATP phosphocreatine system, and it includes two compounds that we have at very small amounts: ATP, adenosine triphosphate, and phosphocreatine. We have these two compounds at very small amounts in our muscles, but their great advantage is that they can produce energy very, very fast, within a fraction of a second. So if I start a maximal exercise like a sprint, or start a sprint during a high-intensity interval exercise, would be, for example, on a bike, or if I start lifting weights, because I need energy, because within a couple of seconds, I need to increase my energy supply very, very fast, very, very rapidly, then I mobilize the very fast pathways. So this is the first energy system, the ATP phosphocreatine, which is very fast but very small. They can provide very little energy. If I need to exercise faster, I have a second system, which I call the lactate system. This is, lactate is the product of carbohydrate breakdown in an anaerobic way, in a way that does not require oxygen. And this system is also very fast, although not as fast as the first one, but produces more energy than the first one. And I mobilize this system usually during sprints. If I need to sprint for like 5 or 10 seconds, I rely mainly on this system. And then comes the third system, which we call the oxygen system or the aerobic system, which includes the breakdown of practically everything, that is carbohydrates, fats, and proteins, with oxygen. This system is practically inexhaustible. It can provide so much energy that you don't have to care about it. But this system provides the energy at a lower pace. So we have this continuum. We have here a very fast but very small system, here an intermediate system, and here a slower but sustainable, very sustainable system. So the body, through very intricate regulatory biochemical mechanisms, chooses. We can't choose that proportion through our mind. Okay, there are biochemical mechanisms that, depending on what the demand is, choose whether they will recruit 50% the first system, 30% the second, or 20% the third one, or the other way around. It is important to know that to note that there is practically no exercise that relies on just one of the three systems. We always have a mixture, no matter what we do, but this mixture differs basically depending on the duration and intensity of exercise. The duration favors the slower but sustainable system. The intensity favors the first system. So when I exercise, I actually mobilize the three systems. But if, as you say, I do different kinds of exercise, I have the opportunity to tweak different systems and keep all three systems in shape, not rely mainly on the aerobic system all of the time and leave our anaerobic systems idle. So I agree very much that it is important to have variation in the kinds of exercise that we do.
That's great, and that leads me to the next point. I saw that you focused at some point in your paper on two concepts: fitness that you were talking about and fatness. So you separate the benefits of losing weight from other benefits that exercise actually contribute that are not necessarily visible to the naked eye. In other words, the exercise leads to other outcomes that are equally important, right?
Exactly. So there is a lot of research showing that exercise, independent of fatness, has benefits on cardiovascular health, on fitness, and on glucose regulation and insulin resistance. So some people speak about the fit but fat paradox. This relies on some research that has compared fit obese people with unfit lean and has found similar levels of fitness. And this is very interesting. Of course, this doesn't go to say that we should not care about getting fat, because if we compare lean people, then lean, fit, and unfit, of course, the lean fit people are in the best of all places. But it is interesting, as you say, to note that the benefits of exercise are not confined to keeping you in shape. There are many, many health benefits of exercise outside keeping you or increasing the chances of keeping you in shape.
That's super important, and I think that one of the, as you know, the general population or the general public focuses on weight loss, and there are different strategies. People use diet, exercise, probably more diet than exercise. But assuming that they were successful in achieving the weight loss, one of the most difficult aspects is to keep that weight loss over time. So the problem of weight regain comes to the forefront. So my question, I guess, is why does regain happen even if people continue doing some kind of exercise and maintaining a relatively healthy nutritional habit? So weight regain is kind of a constant problem. So why is regain happening? Weight regain happening?
Yeah. Well, we haven't been able to fully explain why regain is so frequent. One possibility, from my personal experience with the people that I see, is that they get bored or tired of following a strict dietary and exercise path. Another reason is that very often people think that it is enough to achieve a goal and then forget about it. There is an ancient Greek saying that goes like this: to maintain a benefit is harder than to gain it.
Uh-huh.
So very often in our life, and I'm not talking about just weight, maintaining our weight, we can think of examples of goals that we have achieved after hard work, but then failed to maintain and lost them. I think it's part of the human nature that we are not always focused on a goal. So we say, well, I did some hard work for some months, I did dieting, I did exercise, now I need a break. But as soon as you start your break, you start gaining weight. So I think one remedy of this is not to set too strict or too high goals. For example, if I ask you to lose 20% of your weight, it will be harder to keep that in the long run than if I ask you to lose 10% of your weight and try not to regain weight. So one thing is that we as health professionals should be more realistic and less ambitious about our goals. Another thing is about how fast we want to achieve our goals. One has more chances of maintaining a low weight if they do it more slowly than fast. Because if you want to have a fast weight loss, you subject yourself to many sacrifices that you cannot maintain longitudinally. But if we are more moderate and say, okay, let's not achieve our goals in 6 months, let's do it in over 10 months. Then you increase the chances, because one of the pillars of weight management, apart from diet and exercise, is behavioral modification. In other words, we want people to make this way of life a permanent part of their behavior. We don't want people to change their behavior just until they achieve their goal, but to keep having this mentality. For example, doing a little exercise every day, walk a few blocks rather than driving the car, use a bicycle, eat in moderation, avoid connecting entertainment with food intake. Many people think that entertainment is just going out and eating a lot. So there are these changes in our mentality, our behavioral changes, that if we implement people, this will make it easier to maintain your weight loss and avoid weight regain.
That's actually very good, because it's an integration of psychological factors as well as physical factors. That's true. There's one topic that I want to touch on before we close, and it's the presence of the fatty liver as a result, or in in conjunction with the obesity status. So the fatty liver, first question is, why does it happen? And second, is it like a risk factor in itself for bad outcomes?
Okay. Well, the answer to the first question is because fat can be deposited everywhere. I said at the beginning that our surplus energy is primarily deposited in our adipose tissue, but unfortunately, other tissues like the liver or muscle. I'm sure you have seen when you go to the butcher lean and fatty pieces of meat. So if we gain weight, there is fat deposited in many other places apart adipose tissue, and one of these places is the liver. So of course, this is not the only obesity is not the only reason of fat deposition in the liver, but it is a reason. So if there is surplus fat, some of it will find its way into the liver. And this, the fatty liver, is in itself an independent risk factor for health, mortality, cardiovascular disease, and so on. So it is a very unpleasant condition that we also need to treat through obesity and, of course, other means.
That's great, and I think that leads to our conclusion. And I would like you have touched on this several times during our interview, but could you put together a couple of recommendations for a patient who is intending to lose weight, who is already having changes in his or her dietary habits, how to organize a good exercise plan over a short period of time, and more importantly, how to sustain it over time?
Okay. First of all, as we also hinted earlier, we need a multifaceted approach. So we need a dietary approach, an exercise approach, and a psychological approach. As far as exercise is concerned, which is my specialty, it is good to have the help of a professional, at least at the initial stages. I would strongly recommend to obese patients to seek the advice of an exercise professional. So a trainer, for example. So they are trained, have been educated to prescribe appropriate exercise regimens. And these exercise regimens should take into account first the applicability. If I am an exercise professional, I should look at the patients, talk with them, and see if they, for example, are very heavy, or they suffer from osteoarthritis, or other conditions with their knees, with their joints and things like that, so on. I would have to start by just walking. Give them, prescribe them, ask them to walk for, say, 30 or 60 minutes a day. And as they become stronger, because for people who are untrained, even walking can be perceived as resistance exercise by the body. The body will see this even very mild exercise as resistance exercise, and their muscles will get stronger in a matter of a few weeks. So as they get stronger and more comfortable with walking, we could ask them to do brisk walking, walk faster, or even make a light jog. If we can achieve this, then we should introduce some high-intensity pieces into their treatment. For example, start with light resistance exercise. Ask them to do sit-ups. Ask them to lift light weights. They can do that when they are sitting, if they have problems with standing. There are numerous resistance exercises that are appropriate for people who are not very fit, but they can have very, very impressive results on their fitness, their strength, or their stamina within a few weeks. And then we need what we call progressivity. So the exercise expert will need to review the the improvement of their patients, say every 2 weeks, and see if they are going in the right direction. It is also good to set goals. I can sit down with you and say, what do you think? Could we go to 60 minutes of walking without interruption every, say, 4 days a week? If people have goals set for them, their motivation increases and they can try to achieve them. So start with with a certified exercise professional, set goals, be not too ambitious, be realistic, and regularly review the progress. If after a few months the patient feels that they don't need any more help from their exercise professionals, they can say, thank you very much, I can take it from here. Yeah. So this is my general feeling from the literature and also from personal practice about how to implement exercise for an obese or overweight individual.
That's actually great advice, and that thank you so much, and thank you for sharing all your knowledge with us. And this way, I think we come to an end. For our audience, in the description of the video, you will have a link to the paper of Dr. Mougios, and we welcome your feedback. Thank you, Dr. Mougios, for being with us today.
It's been a great pleasure talking with you.
Thank you so much. And for our audience, see you in the next episode of Decoding Healthcare Research. Thank you.
Bye-bye.
Thank you so much for tuning into this episode. If you enjoyed it, please don't forget to give us a thumbs up and share it with your friends and family. Make sure to subscribe to our channel and hit that notification bell so you never miss an episode. If you have any questions or thoughts about today's topic, we'd love to hear from you. Feel free to leave your comments down below. For more information and references related to today's discussion, you can find them in the video description below. We appreciate your support and look forward to having you back for our next episode.